Welcome to Wise Aging Hub, where we explore the vital connection between acting quickly and saving your life during emergencies. In the world of cardiology, there is a fundamental truth that every doctor knows. Time is muscle, and seconds truly count. Dr. Leonard Javier emphasizes that you possess a fleeting golden window of merely 2 hours to take action before damage occurs. Once that critical window closes, the heart muscle begins to die permanently, leaving scars that will affect your health forever. Understanding this urgency is the difference between a full recovery and a lifetime of chronic heart failure or even sudden death. Today, we will break down exactly what happens inside your body and why waiting to see if it passes is dangerous. To understand the danger, we must first look at the coronary arteries, the vital fuel lines that supply your heart. These arteries are responsible for delivering oxygen-rich blood to the heart muscle, keeping it pumping rhythmically, day in and day out. Over time, plaque made of cholesterol and other substances can build up, narrowing these arteries and setting the stage for disaster. When a plaque ruptures, a blood clot forms almost instantly, acting like a dam that completely blocks the flow of blood. Starved of oxygen, the heart muscle beyond the blockage stops functioning properly and begins the irreversible process of dying within minutes. Scientific studies show that irreversible cell death begins as early as 20 minutes after the blood flow has been cut off. This is why the concept of time is muscle is not just a slogan, but a biological reality we face. Recognizing the symptoms immediately is the first step in saving your own life or the life of a loved one. The most common symptom is chest pressure, often described as a heavy weight, like an elephant sitting directly on your chest. It is important to note that this sensation is often a squeezing pressure, not necessarily a sharp or stabbing pain. This discomfort can radiate outward, traveling down the left arm, up into the neck, or even into the jaw and back. However, symptoms can be subtle, especially in women who might experience shortness of breath, cold sweats, or sudden, inexplicable nausea. Many people mistake these critical warning signs for simple indigestion or fatigue, a mistake that can cost them their lives. Let us compare two real-life clinical cases to see how different reactions lead to drastically different outcomes for the patients. First, meet Mr. Martinez, who felt a sudden crushing pressure in his chest while gardening on a Sunday afternoon. He did not wait or second-guess himself. He recognized the danger immediately and had his wife call for an ambulance. Paramedics arrived within minutes, administering aspirin and nitroglycerin en route, starting the life-saving treatment before reaching the hospital. At the hospital, doctors performed an emergency angioplasty to open the blocked artery within just 37 minutes of his arrival. Because the blood flow was restored quickly, his heart muscle suffered minimal damage, preserving his heart's pumping function almost entirely. Today, Mr. Martinez lives a full, active life with no limitations, proving that quick action truly saves heart muscle. Now consider the tragic case of Mr. Chen, who felt a similar heavy sensation but decided it was just indigestion. Instead of calling for help, he took antacids and lay down, hoping the uncomfortable feeling would eventually go away. 13 hours passed before he finally sought medical help, by which time the damage to his heart was catastrophic. The doctors found that a large portion of his heart muscle had died permanently because it was starved of oxygen. Mr. Chen now suffers from chronic heart failure, struggling with simple daily tasks like walking to the mailbox or climbing stairs. This contrast illustrates the harsh reality that time is the single most important factor in the outcome of a heart attack. So, what is the absolute most important thing you must do if you suspect you are having a heart attack? You must call emergency services immediately, and never, under any circumstances, attempt to drive yourself to the hospital. Ambulances are not just transport vehicles. They are mobile emergency rooms, equipped to restart your heart if it stops beating. Paramedics can transmit your heart data to the hospital while traveling, allowing the surgical team to prepare before you arrive. Driving yourself risks passing out behind the wheel and getting stuck in traffic, wasting precious minutes that you do not have. If the emergency dispatcher advises it, chewing an aspirin while waiting for help can also help thin your blood slightly. Dr. Javier reminds us that medical technology is advanced, but it is useless if the patient does not arrive in time. Prevention is always better than cure, so managing your risk factors like blood pressure and cholesterol is absolutely essential. Knowing your numbers helps you understand your risk, giving you the power to make changes before a blockage ever forms. Your heart is the engine of your life, supporting every moment you share with the people who matter most to you. Remember the 3 steps. Recognize the subtle or severe symptoms. Call emergency services immediately, and wait for the professionals. Do not let doubt or fear of embarrassment stop you from making that call, because it is better to be safe. By taking quick action, you give the medical team the best possible chance to save your heart and your future. Modern medicine can perform miracles, but only if you respect the clock and act within that golden 2-hour window. Educate your family members about these signs today, so that everyone in your household knows exactly what to do. Every sunrise you see is a gift, and protecting your heart ensures you will see many more of them. Acting fast not only saves your life, but also saves you from the immense financial and emotional burden of chronic illness. Even if you have had a heart event, cardiac rehabilitation can help you rebuild strength, but prevention is always superior. Don't leave your loved ones guessing. Have a plan in place and discuss heart health openly with your entire family. Knowledge is your shield, and speed is your weapon against the leading cause of death in the world today. Be like Mr. Martinez. Trust your instincts, act immediately, and give yourself the opportunity to fully recover and thrive. Let the story of Mr. Chen serve as a powerful warning that hesitation can lead to permanent and life-altering consequences. We cannot stop the clock, but we can certainly beat it if we are prepared, aware, and ready to move. Your heart cells are resilient, but they have their limits, and they rely entirely on you to keep the blood flowing. When you call for help, stay on the line, speak clearly, and unlock your front door for the paramedics. The medical system is designed to save you, but you must take the first step to activate that life-saving chain. Protecting your heart is about protecting your ability to participate in the beautiful mosaic of life experiences awaiting you. Never forget the phrase, "Time is muscle." It is the mantra that should guide your actions in any chest pain emergency. Share this video with your parents, your children, and your friends, because this knowledge is a gift of life. Thank you for listening to this crucial advice from Dr. Javier, and for taking your cardiovascular health seriously today. Cherish every breath, listen to your body's signals, and never hesitate to seek help when something feels wrong inside. Recap the signs: chest pressure, arm pain, jaw pain, nausea, and shortness of breath are your cues to act. Keep your phone charged and nearby, and ensure your house number is visible for emergency responders to find you easily. Life is precious and fragile, but with the right knowledge and quick action, we can protect it effectively. You have the power to turn the odds in your favor simply by choosing not to ignore what your body says. Stay vigilant, stay healthy, and keep your heart beating strong for all the adventures that are yet to come. We hope this detailed breakdown helps you understand the critical mechanics of heart attacks and the importance of speed. If you found this video helpful, please like and share it to spread this life-saving message to others. Your support helps us create more content that empowers you to age wisely and live a longer, healthier life. Remember that your health is your greatest wealth, and investing time in learning about it is the best investment. Stay tuned for our next video, where we will discuss nutrition tips for keeping your arteries clean and flexible. Thank you for watching Wise Aging Hub. Please subscribe for more vital health insights. And remember that time is truly muscle.